It's just one glass of wine, maybe two, a nightcap before bed, a toast at dinner. For most of your life, it felt harmless, maybe even healthy. But after 60, everything changes. Your brain isn't the same as it was at 30 or 40, and even small amounts of alcohol, the kind you barely notice, can begin to affect memory, mood, balance, and sleep in ways that build up quietly over time. We've been told red wine helps the heart, that moderate drinking is part of a good life. But new science tells us something else. For aging brains, alcohol may do more harm than good. That relaxing glass of wine, it might be disrupting your REM sleep, shrinking parts of your brain tied to decision-making, making it harder to remember words, or throwing off your balance the next day. And you may not notice it right away. The effects are slow, subtle, but real. In this video, we'll explore exactly how alcohol affects the aging brain, why it's more dangerous after 60, how it interacts with common medications, and what you can drink instead to support clarity, sleep, and long-term brain health. If you or someone you love drinks regularly and is over 60, this could be one of the most important things you learn today. Let's take a closer look. After 60, the brain begins to shrink in volume, losing both gray matter and white matter. That means fewer nerve connections, slower information processing, and reduced flexibility in how we think and react. At the same time, blood flow to the brain decreases, making it harder to deliver oxygen and nutrients where they're needed most. Now add alcohol into that picture. Alcohol is a central nervous system depressant. It slows down brain activity, reduces blood flow even further, and affects the same brain areas already vulnerable in older adults. The prefrontal cortex, the part of your brain responsible for reasoning, planning, and decision-making, is especially sensitive to alcohol. Even small amounts can make it harder to focus, solve problems, or think clearly. And the hippocampus, your memory center, is another high-risk area. Long-term exposure to alcohol can shrink this region, leading to forgetfulness, confusion, or even mild cognitive impairment that gets mistaken for normal aging. For younger adults, the brain is more resilient, but after 60, recovery is slower and the damage lasts longer. You may notice you feel off the day after drinking, even if it wasn't much. That's because the brain can't bounce back the way it used to. And the effects aren't just temporary. Over time, repeated alcohol exposure, even at moderate levels, can speed up brain aging, increase the risk of dementia, and lower overall mental sharpness. Next, we'll go deeper into what actually happens inside your brain after just one drink, and why even a little alcohol might be too much for the aging mind. You might think, one drink isn't a big deal. But the moment alcohol enters your bloodstream, your brain begins to change. Alcohol affects neurotransmitters, the chemical messengers that help your brain cells communicate. It increases the activity of GABA, a calming neurotransmitter, which is why you may feel relaxed or sleepy after drinking. But it also suppresses glutamate, the chemical that keeps your brain alert and responsive. This imbalance slows brain activity, weakens short-term memory, and reduces coordination. Even with just one drink, your reaction time slows, your judgment is impaired, and your ability to concentrate decreases. The prefrontal cortex, the area responsible for decision-making and impulse control, becomes less active. That's why people may speak more freely, make poor decisions, or feel overly emotional after drinking. And that's not all. The hippocampus, which helps you form new memories, becomes less effective. That's why you might forget parts of a conversation, misplace things, or feel mentally cloudy the next day. In older adults, these effects are more intense because the brain is already more sensitive and alcohol stays in the system longer. So even if you've handled alcohol well for decades, your brain now processes it differently. And these short-term effects can add up. especially if drinking becomes a nightly habit. Coming up, we'll look at why alcohol has a stronger impact on older adults, even at lower doses, and why moderation looks very different after 60. After 60, your body doesn't process alcohol the way it used to. You may notice that one glass of wine hits harder than it did 10 years ago. That's not your imagination, it's biology. As we age, the amount of water in the body decreases and muscle mass declines. That means alcohol becomes more concentrated in the bloodstream, even when drinking the same amount. The liver also slows down, making it harder to break down alcohol efficiently, so it stays in your system longer, affecting your brain, heart, and balance for hours. Your brain becomes more vulnerable to the blood-brain barrier, which protects your brain from toxins, becomes more porous with age. That allows more alcohol to reach sensitive brain areas like the prefrontal cortex and hippocampus. Older adults also tend to take more medications for blood pressure, cholesterol, sleep, pain, or mood. And alcohol can interact dangerously with many of these drugs, causing confusion, dizziness, or extreme fatigue. Even small amounts of alcohol combined with medications can lead to mental fog, unsteady walking, or risky falls. What's even trickier is that these effects often go unnoticed. You might just feel a little off or not as sharp, but over time the pattern adds up. What felt like a harmless drink might actually be tipping your brain and body out of balance. Coming up, we'll explore how alcohol disrupts your sleep and why that lost rest can accelerate brain aging more than you think. One of the biggest myths about alcohol is that it helps you sleep. Yes, it can make you feel drowsy at first. You may fall asleep faster after a glass of wine or a nightcap. But what happens after you fall asleep is the real problem. Alcohol disrupts your sleep cycle, especially the REM stage, the deep, restorative sleep your brain needs to repair and recharge. Instead of moving smoothly through sleep stages, your body stays in lighter sleep and wakes up more often during the night. This is even more pronounced after 60, when the natural production of melatonin declines and sleep becomes more fragile. You may find yourself waking at 2 a.m., heart racing, mind alert, unable to fall back asleep. That's because alcohol raises cortisol, the stress hormone, just a few hours after you fall asleep. And when your brain doesn't get enough deep sleep, it can't clear out toxins like beta amyloid, the sticky protein linked to Alzheimer's disease. That's why poor sleep, over time, is now considered one of the strongest risk factors for cognitive decline and dementia. Alcohol also reduces oxygen flow during sleep, especially in people with sleep apnea or snoring. You may wake up feeling groggy, even after a full night in bed. Your thinking may feel slower, your memory weaker, and your mood more irritable. And if this happens night after night, your brain never fully recovers. That one glass before bed, meant to relax you, may be silently draining your clarity over time. Next, we'll talk about how alcohol contributes directly to memory loss, confusion, and long-term cognitive decline in people over 60. Have you ever forgotten where you put your keys, or struggled to remember a conversation from yesterday? It's easy to blame these moments on aging, but alcohol may be playing a bigger role than you think. Inside your brain, alcohol affects the hippocampus, the region responsible for forming and storing new memories. Even moderate drinking can shrink this area over time, making it harder to learn, recall, or stay mentally organized. One major study from the University of Oxford followed over 25,000 people. It found that those who drank just 1 to 2 drinks daily had noticeable reductions in brain volume, especially in areas linked to memory and decision-making. And the effects are even greater in older adults. Alcohol not only damages neurons, it slows the brain's ability to regenerate them. That means the brain becomes less adaptable, less resilient, and more vulnerable to permanent decline. You may notice more senior moments, like forgetting names, losing track of time, or repeating yourself. At first, these may seem harmless, but over time they can progress into mild cognitive impairment, a warning sign before dementia. For some, these symptoms accelerate quietly, especially when combined with other risk factors like poor sleep, high blood pressure, or medication side effects. Even worse, alcohol impairs insight, meaning you may not realize how much your memory or focus has declined until it's deeply affected your daily life. And because these changes happen slowly, many older adults never link them back to alcohol. But science now confirms what many doctors have observed for years. Consistent alcohol use, even in small amounts, increases the risk of dementia. Next, we'll explore how alcohol doesn't just affect thinking, but also your emotions, mood, and mental health after 60. Alcohol doesn't just affect your memory, it also changes how you feel. Many people drink to relax, to take the edge off, to feel more social or less lonely. And for a while, it might seem like it helps, but in the long run, alcohol can quietly wear down your emotional stability. That's because alcohol interferes with brain chemicals like serotonin and dopamine. These are the neurotransmitters that regulate mood, pleasure, and emotional balance. After 60, your brain becomes more sensitive to changes in these chemicals. Even small drops can cause noticeable shifts in how you feel. You might notice more irritability, more sadness, or a sense of emptiness the next day. Some older adults describe a feeling of emotional flatness after drinking, where things they used to enjoy no longer feel rewarding. Others report increased anxiety, a racing heart, restless thoughts, or nervous tension, especially a few hours after the effects wear off. This emotional rebound from high to low becomes more intense with age, and when it happens regularly, it increases the risk of depression. What's more, alcohol can numb the early signs of emotional distress, making it harder to ask for help or even recognize that something's wrong. And for those already dealing with grief, chronic illness, or isolation, common in later life, alcohol can deepen those feelings without offering real relief. Some turn to alcohol for sleep, others for comfort, but over time, the brain forgets how to regulate emotions on its own. And that leads to a dangerous cycle. The more you drink, the more emotional support your brain loses, making each day harder to face. Clearly, next, we'll talk about one of the most overlooked dangers of alcohol after 60, how it interacts with medications and silently increases your risk of confusion, falls, and emergencies. If you're over 60, chances are you take at least one medication, maybe for blood pressure, diabetes, arthritis, sleep, or mood. Now imagine adding alcohol to that mix. Even one drink can change how your medications work, and sometimes the effects are dangerous. Your liver is responsible for breaking down both alcohol and medications, but it can't do both at the same time, so when alcohol enters your system, your medications may stay active longer or not work at all. For example, if you take blood pressure medicine, alcohol can make it drop too low, causing dizziness, fainting, or a dangerous fall. If you take sleeping pills or anti-anxiety drugs, alcohol amplifies their sedative effect. You may feel overly drowsy, confused, or even slip into a state that feels like intoxication without drinking more. Blood thinners like warfarin, alcohol increases the risk of internal bleeding, especially in the brain. Diabetes medications, alcohol can cause blood sugar to crash suddenly, leading to weakness, confusion, or loss of consciousness. Even something as common as ibuprofen, when mixed with alcohol, can raise the risk of stomach bleeding or kidney stress. And here's the difficult part. These reactions don't always happen right away. They build slowly, or appear in the form of mystery symptoms. You might feel mentally foggy, lose your balance, or forget what you were doing, and never realize that the interaction between alcohol and your daily pills is to blame. Many older adults end up in the ER from falls, confusion, or accidents that could have been prevented with less alcohol. Next, we'll explore what you can drink instead. Healthier, brain-friendly options that help you relax, sleep better, and stay mentally sharp without the risks. You don't have to give up comfort, celebration, or routine just because you're cutting back on alcohol. There are better options, safer options, that still bring warmth and relaxation without hurting your brain. Let's start with herbal teas. Chamomile, lemon balm, and passion flower have been used for centuries to calm the nervous system. They can reduce anxiety, improve sleep, and support a peaceful evening routine. Then, there's tart cherry juice, naturally rich in melatonin. Tart cherries help regulate your sleep-wake cycle. Studies show that drinking it before bed can increase sleep time and improve sleep quality, especially in older adults. Want something festive for social gatherings? Try sparkling water with a splash of fresh juice. Add lemon, lime, or cucumber slices for flavor, or a few crushed berries and mint. You can even make your own mocktails using ingredients like ginger, turmeric, cinnamon, or apple cider vinegar. These not only taste good, they reduce inflammation and support brain health. Another powerful choice, golden milk, a warm blend of turmeric, milk, and black pepper. It's anti-inflammatory, calming, and brain protective. If you miss the feeling of unwinding, build a new habit around your drink. Put your feet up, dim the lights, listen to music, talk with a friend, or read a few pages of a good book. The comfort doesn't have to come from alcohol. It can come from the moment you create. And the best part, these alternatives support your brain rather than drain it. Each small swap helps your neurons, your memory, your sleep, your clarity. Coming up next, we'll bring everything together and show you how even the smallest changes can lead to a sharper, stronger, and healthier brain after 60. Now you know what that glass of wine, that sip of whiskey, or that evening cocktail might really be doing to your brain. Not just today, but slowly, over weeks, months, and years. After 60, every part of your brain becomes more delicate, more responsive, more vulnerable. And while alcohol may feel like a small indulgence, for the aging mind, it can be a powerful disruptor. It's not about guilt, it's about awareness. When you understand how alcohol affects sleep, memory, mood, and medication, you can start making choices that protect your clarity, your independence, and your joy. Because even small changes like swapping your drink, skipping the nightcap, or drinking less often can have a powerful impact on how you feel every day. And you don't have to do it alone. At Elderly Care, we're here to walk with you, to guide you with science, and to support your journey toward a healthier, sharper, and more vibrant brain at any age. If this video opened your eyes, please share it with someone you care about. Leave a comment below. What's your experience with alcohol after 60? Have you noticed changes in sleep or memory? And don't forget to subscribe to Elderly Care for more science-backed insights on how to care for your brain, body, and well-being. One smart choice at a time. Your brain is worth protecting. Every day, every decision, every sip.